Good afternoon. Thank you for joining us today. I'm Tiffany Collins, Deputy Director of General Services for the City of Memphis. I am presenting on behalf of the City of Memphis and the Joint Task Force. As we approach the holidays, please consider how your plans could contribute to the spread of COVID-19. It has been shown that small gatherings do contribute to the spread. And while we understand spending time with your family this Thanksgiving is very important, we would like for you to consider only spending this holiday with those in your immediate household and not in interacting with those outside of your household via virtual or other means. If you choose to celebrate with people outside of your household, we'd like to offer you a couple of tips to keep you safe. Please limit contact with people outside of your household. Wear a mask at all times around people who do not live in your household. Limit contact and maintain 6 feet of distance with people who are outside of your household. Limit contact of commonly touched surfaces such as doorknobs. Wash your hands frequently with soap and water and get tested before gathering. And because we understand asymptomatic testing is very important, the City of Memphis is hosting a mass testing event this Saturday and Sunday at 4 locations and Sunday at 3 locations. Shelby County Schools Administration Building, the Lamar Inspection Station, the Applin Inspection Station, and Poplar Healthcare. On Sunday, we will be hosting testing at Poplar Healthcare, the Applin Inspection Station, and the Lamar Inspection Station. If you think that you may have COVID-19 or may have been exposed, we ask that you limit contact with individuals outside of your household, quarantine, and get tested. I would like to open up the floor to Dr. Randolph of the Shelby County Health Department.
Thank you. Greetings, fellow citizens of Shelby County. Dr. Bruce Randolph, the Health Officer for Shelby County Health Department. I'd like to provide you with an update on our data, after which open it up for discussions. Today, we're reporting that we've had a total cases of 44,222. Today, we're reporting new cases, 389. Total deaths as of today, we're reporting 624. When we look at these deaths and these cases, we see that the number of deaths represent 1.4%. So the case fatality rate of deaths occurring is 1.4%. We find that since March, when we started testing, we have tested over 350,000 people. Matter of fact, 350,506 people have been tested, of which 44,222 have tested positive. So that gives us a positivity rate of 12.6%. When we look at the total number of tests that we have run since March, it comes to 625,500 tests. And of those tests that we have performed, 53,524 of them have been positive, which represents a test positivity rate of 6.8%. Our test positivity rate by the week is up now to 9.6%. So almost 10% of the tests that we're running are testing positive. When we look at our number of cases that have increased, the 7-day average, we see that our 7-day average number of cases is up to 443 per day. That's the 7-day average. That's some concern to us. If you notice in the health directive, 450 cases per day on 7-day average is a setback. It's a criteria for a setback. So we're watching those numbers very carefully to determine what action we need to take to address this escalating number of cases that we're experiencing. But I want to dig a little further because I really want you to understand our situation. When we look at those who unfortunately have died from COVID-19, 86% of those occurred among people aged 55 to over 85. 88%. So most of the deaths are occurring among our seniors. But even when we look a little deeper at the deaths and the comorbidities that people experienced, we find that 81% of those who died had cardiac conditions, 46% had respiratory conditions, 21% obesity, and 45% diabetes. So obesity, diabetes, respiratory conditions, cardiac conditions are risk factors and comorbidities that increases your chance of dying if you happen to get infected with the COVID-19 virus. Also, when we look and see, well, who else are dying, we find that most of the fatalities are occurring among black people, African American people, to the point of over 60%. We also look at the fact that when we ask, well, who's getting infected? Not who's dying, but who are the cases? 67% of the cases occur among people ages 18 to 54. So younger people are getting infected, older people are dying, and that's the problem. You know, the young people, you go out and you have fun and you party and you feel that, you know what, this virus doesn't affect me. I'm not having any of the major complications, don't have to go to the hospital. But you can bring the virus home to your loved ones, to your mother and your father, to your grandparents. And if they get infected, they're the ones who are likely to die. And I'm just spending time to really plead and to emphasize that our numbers are going up. The pandemic is still here. We must do our part, each and every one. We must mask up, not so that we can do more. At this stage, we must mask up so we can remain open, because we got to do something. We can, the choices are, well, you do nothing and just let things ride out, or you go and close things down. We're trying to find some in between. We're trying to find some way to try to remain open as much as possible, but yet we got to protect all of our citizens. So we're urging you, this coming holiday, please wear your mask at all times possible. Maintain the social distancing, at least 6 feet. Avoid the crowding. Get tested. If in doubt, check it out. Go get tested. Wash your hands clean and disinfect, because these are the only tools we have. And it's very important that each and every one find it within ourselves to be responsible and to care for the least of these, our loved ones, and those who are more vulnerable. I think I'll stop here and just entertain any specific questions that you may have at this moment.
Corin Kennedy, Commercial Appeal.
Hi, good afternoon. Dr. Randolph, based on the health department's conversations with state officials and other local officials, what is the plan for how a vaccine will be distributed in Shelby County, both in terms of who will be the first people to get the vaccine and the logistics of how it will be distributed? And I'll have a follow-up.
So the preliminary plans for the vaccine is that sometime in early to mid-December, we are anticipating receiving the vaccine. And the plans are that it would go to our larger hospitals, who will also ensure that those who are inpatients with some of these underlying conditions that I described, and over age 65, and the health care workers who are at risk of exposure to COVID will be the first to receive the vaccine. They're the ones who would meet the category of phase 1A. And then there's a phase 1B, which are other healthcare workers and other people. Also, I would say in that phase 1A category would be your first responders, EMS, and other people who are out in the forefront, the front line, and who is at greatest risk of exposure. And then the vaccine would be provided to other people such as teachers, daycare workers, the vulnerable population, other people who are at risk. And eventually the general population who are more healthier, at less risk would receive the vaccine. This vaccine is a 2-dose vaccine that you're given approximately 21 days apart. And so that's kind of the summary of the details. More specific will come.
And as a follow-up, national polling has showed that a significant number of Americans say they either do not want to receive the vaccine or are unsure about whether they will receive it. What educational campaigns is the health department planning to get information about the vaccine to people in Shelby County who may be skeptical or unsure about if they want to receive it?
Well, uptake is very important. I mean, just having a vaccine sitting on a shelf doesn't do us much good. The important part of that is we must have information related to the safety and effectiveness of the vaccine. So as soon as we get all of that information from the FDA relating to the effectiveness and safety of the vaccine, our job would be to disseminate this information and to provide the assurance and comfort that this vaccine is indeed safe. What we have received in terms of reports from the manufacturers of the vaccine is that it is 95% effective with minimal side effects, such as some fever, headaches, aches, that goes away in 48 hours. But we will certainly expect more information. This vaccine will be scrutinized by independent sources to make sure that it is indeed effective and safe. And once we are assured of that, then we will educate the public to that facts.
Brad Broders, Local 24.
Good afternoon, Dr. Randolph. I know Dr. Haushalter was talking about the potential places impacted in the new directive on Tuesday. Just to update since Tuesday, for folks wondering out there, are we still looking at gyms, limited service restaurants? What details can you provide today as you consider this tomorrow?
Well, we are still looking at specific data. I will say to all businesses, establishments, services, and individuals, it is important that we all do our part and adhere to the safety measures in the health directive. Wearing a face mask at all times will be emphasized. Other than the moments that you're sitting, eating, drinking, otherwise you will be expected to have your mask on. While sitting, socializing, in whatever setting, we're asking that you wear your mask. That would be very important. Social distancing would be limiting the number of people inside a facility, because now that the weather has gotten cold, people are not outside. We know that ventilation is very important. And so therefore, the number of people within an establishment or facility may not necessarily be what it used to be. We're having to look at that and see if there's a way that we can affect that. Also, enforcement. Now, fellow citizens, it's important that we all abide by the safety measures and adhere to them. Now, we get reports where folk will, if the time has been that you close at 10, people pretended to close at 10 and then reopen later and stay beyond the hours that are allowed. We can no longer have that. If we're going to remain open, we got to do right. We got to mask up, and we got to separate.
Thanks, Dr. Randolph. And as a follow-up, is it still the plan to unveil some kind of new restrictions tomorrow, or is that going to potentially change? And what's the message out there as unemployment claims are up of how you all are trying to balance the economic impact this could have versus the public safety?
We're working on, in conjunction with the public of policymakers and officials, a directive that we will issue no later than Monday. It may be sooner, depending on the progress we make on it. But by Monday, we are anticipating issuing a new directive.
Dominique Dillon, Fox 13.
Good afternoon. There's reports that Jackson Madison Hospital is no longer taking transfers, and I just want to know how that will affect our hospitals and will we have adequate space?
Well, one, I'm not knowledgeable about the situation there at Jackson Madison, but of course, our healthcare system is a regional healthcare system in the sense that we have patients coming from areas outside of Shelby County. And so if healthcare is not available in other locations, certainly people will come here. When people come here, then that also will impact our capacity and capability of providing services. So that is another reason why we are concerned, another reason why we are really urging public officials in the surrounding areas to join with us in encouraging and actually mandating the wearing of face masks and the implementation of the safety measures to help mitigate this virus and decrease the transmission, because we're all in it. And, you know, Shelby County just can't have a mask mandate and everyone around us not have it. It limits the effectiveness of it. We all need to be on one accord, and we all need to be committed to doing what it takes to decrease this transmission of this virus, because it will impact all of us.
Dominique, did you have a follow-up?
No, thank you.
Kendall Downing, WMC.
Good afternoon, everyone. I was wanting to ask about the alternative care facility. Given the new numbers and the modeling, is there a projected open date for that? And then I had a follow-up.
No, I don't. I'm not aware of a specific anticipated date of opening the facility. I think we still have a ways to go. The decision to open that will be a decision made by the state, and we're not there yet.
All right. And then the other question would be for business owners that have been through some of these closures at this time, for some of them, multiple rounds of closures or restrictions on their operations. What's your message to them who may be feeling frustrated about how this is impacting their livelihoods? I know we can see the end in sight, but unfortunately we're not there yet. What's the health department's message to those who have been through rounds of restrictions?
Our message is this, is that we understand the economic impact that closures are having, but we also want you to understand and appreciate the health impact of not wearing the mask, not adhering to the health directives, not limiting the crowds, not keeping people from gathering, and the impact that that's having on the health of our citizens. And so our goal is to try to strike some balance. And the reality is that a healthy community is a community that also will thrive economically. They're tied in. And so if we're able to control this virus and decrease the transmission of it, then we're able to do more. Again, that's why we must mask up so we can do more. But at this stage, due to our numbers being as they are, we must mask up to stay open. And that's what we're trying to do. And that's why we're emphasizing that you can do your part. Make sure the patrons and your employees are adhering to the safety measures outlined in the health directive.
Jane Roberts, Daily Memphian.
Hi. We have heard from some of the suburban mayors that it could be 2 weeks to a 28-day restriction. Can you comment? And then I have a follow-up.
Well, our practice have been that whenever we make changes to the health directive, we monitor things on a 2 weeks basis. And the logic behind that is because the incubation period for the virus is 14 days. And so in order to make a significant impact in terms of the transmission or the mitigation of the transmission of this virus, you need at least 2 incubation periods to see real true effects. So, I would be reluctant to give a specific time frame, but I would say that whatever changes that we make to anticipate them being around long enough for us to really see an impact, which would be at least 2 incubation periods.
Jane, did you have a follow-up? I think we may have lost Jane. Jacob Steimer, Memphis Business Journal.
Yeah, I wanted to clarify something you said earlier. You were talking about in the health directive, Tripwire has 450 cases a day as a criteria. But we're talking about this new health directive that you expect by Monday. If for some reason cases start going back down, tomorrow, Saturday, Sunday, is it still up in the air whether or not we'll have new restrictions? Or do you feel like since we're closing in on that 450, it doesn't actually have to go cross it before we'll see some sort of new restrictions in place?
It is our opinion that things are at a point where we need to take some action. Now, the action may not be what is outlined in accordance to the tripwires. Maybe something less than that. But indeed, we must act now, because if we wait too long, then the numbers would be even worse. And so the projection, or the trend, should I say, indicate to us that we have to do something. And so we will, but not necessarily completely what's spelled out in the health directive as it relates to tripwires, unless we reach that threshold.
We are out of time. Are there any closing messages today?
Thank you for joining us again. We ask that you take advantage of the free testing events that we'll be hosting this weekend. You can find more information about these events on the city's website. Know your status before you gather this holiday season. Thank you.
Thanks, everyone. Stay healthy, and we'll see you next week.